What's up, guys, and welcome to episode 41, Referrals. So the name of this episode is Assess the Need to Refer Patients for Assistance with Actual or Potential Problems. So you as the nurse working with the patient all day, you're going to be seeing, hey, does this patient need help getting out of bed? Does this patient need, a walker or something like that? Are they going to need some support at home? So we're going to advocate and assess for the need for referrals on an internal basis. So things like physical therapy, occupational, nutritional, those kinds of things while inpatient, and we'll talk to the physician, hey, you know what, I think this patient could use a physical therapy order, and talk to the physician and get that order entered. Although, caveat to that, physicians are pretty good at noticing that stuff. They're also, if a patient has come in, let's say with a stroke or heart failure or something, typically they're really good at ordering that stuff. Those kinds of consults are also parts of order sets so that physicians don't forget that kind of stuff. But in my personal experience, if a patient has blank diagnosis, they're going to say, hey, I want physical therapy to see him. Or, hey, they're on tube feeding. Got to have that dietitian seeing the patient, ordering the tube feeding. I'll do whatever tube feeding they want. And it's a great way because we're maximizing each member of the healthcare team and their expertise. It's not, I don't think, personally, a physician to know every tube feeding formula inside and out and taking time to calculate that. I think it makes a lot more sense to have a dietitian who eats, sleep, and breathes that and knows it really, really well. And they're delegating that responsibility to that person. So you as the nurse on the bedside, you're going to be seeing, hey, do we need these kinds of referrals? But we're also going to be trying to assess what kinds of referrals will this patient need upon discharge. So will they need, public transportation? Will they need to go to a shelter, respite services, meals on wheels, like those kinds of services on the not outpatient, but discharge sides of things. So that's really important for us to assess as well. And we can work with our case manager and whomever at that facility that really facilitates referrals. And it's not just saying, hey, you have this problem, we need to get this. It's also anticipating them as well. So maybe while the patient is getting along fine here, they may need some resources upon discharge just in case. So we really want to work with our other members of the healthcare team to facilitate this process. Some hospitals, let's say patients need to go to a specific nursing home, nursing facility. A lot of hospitals employ referral coordinators where they take care of that burden of paperwork and make sure all of the things that are needed to go to these facilities are there and they qualify, and it's wonderful because they really take that huge burden off the bedside nurse. But these referral coordinators are typically nurses. Important to, if you're actually doing the referral, making sure you have all of the paperwork is essential. Absolutely essential. Sometimes they require things like H&Ps, a history and physical. It's an aspect of the chart. Sometimes they require various forms with signatures on them, insurance information, the actual referral form. So lots of paperwork, when we're doing referrals for things an outside agency would do. But typically when we're thinking inpatient wise, and we think another service needs to see the patient, the physician has to put in that order, and then we see that that's facilitated on the inpatient side. So that's a little information on referrals. They are wonderful because we're utilizing multiple members of the healthcare team that are experts in what they're doing and leveraging that expertise. So we as the nurse aren't inundated with, too much information that we could easily delegate that to someone who eats, sleeps, and breathes that. So referrals are absolutely something we do all the time. It's really good to know them. Another point on this test plan that's essential. So that is a little bit more information on referrals. So thanks for listening to episode 41.
This has been another episode of the unofficial NCLEX Prep Podcast. To get the massive PDF guide that goes along with this podcast, head over to nrsng.com/NCLEXprep. That's nrsng.com/NCLEXprep. That's a free download that you can take with you anywhere, and you can basically have this podcast in text format. Our goal here at nrsng.com is to give you the tools and the confidence that you need to succeed in nursing school, on the NCLEX, and in your life as a nurse. We want you to succeed, and we want you to become part of this movement of nurses that is dedicated and motivated to learning and becoming the best nurse that they can possibly be. My name is John Haas, RN CCRN, and I'm the founder of nrsng.com, and I sincerely thank you for being here, and I'm so proud of you for taking this step in your journey. Now you know what time it is now. It's time to go out and be your best self today. Happy nursing.